Good. Okay, I'm not Angela Leo, but Angela was the honors student who did this project and now works with Martin Zetterston, and probably will be applying to grad school, so look out for her name. And Yueyan Tang, who many of you know and the rest of you should meet, is the other collaborator who oversaw this project, and our excellent colleague Shannon Ellis, Professor Shannon Ellis in the Cog Sci department, did this work. And so this follows on the topic of a lot of the work in our lab on joint attention, which I'm going to define as events when two or more individuals coordinate their attention towards a target based on social cues, right, as opposed to based on some extrinsic attention-getting property of the event, right? So using social cues to guide attention, which in human infants emerges around 6 months and consolidates over the next 6 months to a year. And is thought to provide opportunities for information sharing between caregivers and infants, as well as teachers and students and anyone. Early joint attention skills have been associated sometimes with some outcomes in language acquisition, object exploration, and social learning. So there's quite a bit of interest in these things. Within the scope of the larger scope of joint attention, a lot of our work has focused on attention following in infants, wherein an infant follows another person's behavioral cues towards the focus of that person's attention. For example, following the direction of somebody's gaze or following a pointing gesture. And there's a lot of interest in this because these attention following episodes set the stage for more elaborate triadic interactions, which potentially provide infants with the opportunity to learn about the social world as well as learning about objects and things. Right, so one question we may have is how infants learn to respond to different kinds of cues that caregivers may produce to elicit attention sharing. So let's talk a little bit about cues and cue combinations that prior research have shown can trigger or potentiate attention following. The one that's been most studied is gaze. We know that infants can follow the direction of somebody's gaze but before a year of age. However, more recent research has shown that infants generally don't monitor caregivers' gaze or even look at caregivers' faces very often, although there's some variability, cross-cultural variability in that. And they just usually don't respond to a simple gaze shift by an interlocutor. However, we know from previous research, or we think from previous research, that at least in some cultures, caregivers tend to combine gaze and pointing gestures to get infants' attention. And there's some work suggesting that this combination, combining a manual gesture and gaze, can promote attention following by 9 months of age, at least in laboratory settings. And possibly because those two cues provide some redundancy by giving a sort of directional vector or allowing implication of a directional vector in two modalities. Okay, well, as I'm going to show you in a minute, one thing that happens in some cultures naturalistically is that caregivers combine gaze, point, and also speech or language acts to direct infants' attention. In the first couple studies of this, looking at how speech may enhance attention following in infants, there were pretty modest findings, right? So early findings suggested that added speech doesn't reliably increase attention following, but may prolong it. So there's some ambiguity there. And laboratory studies are sometimes hard to interpret. There are, of course, other cues besides these. For example, we know from work that we've done and done in Chen Yu's lab with Linda Smith that other cues like object handling are actually more effective than these, but these still do occur in the wild. So for the rest of the time, I'm going to talk about this combination of gaze cues, point cues, and speech cues, and how those potentiate attention following in infants. And we wanted to drill down and look at the speech component of that and ask, well, what do caregivers say during interactions to try to redirect infants' attention? There's quite a lot of complex and rich content in caregivers' naturalistic infant-directed speech. Among the semantic, syntactic, and pragmatic content that you find in that, Some of the categories are object labels, attention eliciting locutions like, look, see that? The infant's name. Parents refer to their infant by name sometimes to get their attention. Affirmations and social routines, as Jack Terwilliger had a poster on that yesterday. Declaratives, imperatives, and questions. So it's a very rich set of stimuli for infants. What I'm going to focus on for the rest of the time are these three categories: object labels, attention eliciting locutions, and the infant's names, which occur with pretty high frequency when parents are trying to get their infant's attention, at least in English-speaking weird families. Okay, so drilling down into this combination, we asked, how do caregivers combine gaze, pointing, and speech cues to direct infants' attention? And how do caregivers structure these multimodal bids for infants' attention? And how does that change from 6 to 9 months of age, this kind of really rich period where infants are just starting to follow attention? And we wanted to know more about the speech cues. Today I'll talk about how often caregivers use these three content types and how they combine them in attention bids. And then, of course, we want to know the efficacy, right? Can we look for relationships between these different speech content types in bids for infants' attention as predictors of the efficacy of those bids? Okay, so method, actually Bettina kind of gave me a nice introduction. It was the same study, the same set of infant mother dyads from San Diego in a longitudinal study, which we started years ago with Yueyan Tang. And part of that study, we did home visits every month from 4 to 9 months and 12 months. And today I'm going to talk about data from the 6, 7, 8, and 9 month visits. And Bettina talked about the free play task. After that free play task, we did an attention following task in which mothers spent some minutes trying to direct infants' attention to several targets. And it was completely unscripted. We simply asked parents, try to get your infant, your baby, interested in these things, and gave them no other instructions about how to do it. So it's naturalistic in some ways and not in others. We set up in every home 3 target puppets in the front, side, and back of the infant, and a couple of other distractor toys. So here's just a still image showing a mother pointing and looking at the side puppet, and we've kind of circled where the other puppets were from this camera angle. They're not very visible, and of course we don't know whether she's saying anything during this period. To code this, we coded cues that moms used within bids, and then whether the infants responded, which we call hits. So the infant behavior coded, we coded continuously all the infant's visual fixations, the time and target. We coded the caregiver's manual actions, including points, the parents' gaze shifts and what they fixated on, and transcribed all their speech and tagged it for a number of content types, including the ones that I mentioned before. What we define as a bid is a period of time beginning when the mother begins her first cue towards a given target, and then continuing until she ends the last successive cue to that same target. So that whole period, which can include an indeterminate number of individual cues, is a bid with no more than a second between each cue. And then what we call a hit is if the infant shifts their attention from somewhere else to that target within the bid period. Okay. Hope that all made sense. Okay, so first of all, what are the combinations of cues that parents spontaneously use when simply asked to get their infant's attention to a target? So here are the data from 6, 7, 8, and 9 months, and I'll just reveal it. It's really pretty clear. Overwhelmingly, they use all three types of cues within bids, more than any combination of 2 or 3. Just G is gaze, S is speech, P is point, and just look at the high purple box plot on the right. That's the combination of all 3 cues at every month. Okay, and then we asked what was the speech content they used, and really quickly, oops, sorry, I forgot to animate that. It's when you make changes at the last minute. Yeah, so the violin plots show that parents used object labels and attention elicitors a lot more than the infant's name, which is, we'll talk about in a second. And then in terms of whether the speech content mattered for infants following gaze, what we found is that bids that included at least 2 content types elicited more hits than bids that included 0 or 1 speech content type. So the number of different ways that parents use speech to try to redirect infants' attention mattered. At 6 and 7 months of age, it's significant. Okay, so key takeaways. Caregivers predominantly use multimodal cue combinations, including nonverbal and verbal cues, to redirect infants' attention, and these combinations do seem to facilitate infants' attention following. Within speech cues, object names and attention-eliciting locutions were more frequent than calling infants by name at every month. We know from previous work that caregivers call infants' name to kind of gather the infant's attention, and so it can be a preamble to redirecting infant's attention, but of course calling the infant by name is used for other purposes as well. So this asymmetry probably reflects kind of task-specific communicative goals of the different content types. There were more verbal content types used within bids, especially at the earlier months. It's possible that younger infants need more scaffolding. They're only beginning, actually only some infants are only just beginning to do attention following at 6 months. So it's kind of a hard task at 6 months. There's a possible paradox because we don't expect usually parents to use more elaborate speech to younger infants. But on the other hand, in this task, older infants don't need as much verbal scaffolding, don't need as much encouragement to get them to follow attention. Nevertheless, with older infants, we have other evidence in previous studies that combining verbal cues with nonverbal cues can enhance attention following. Limitations in future directions. This was an English using weird sample. We know that infant-directed speech and joint attention are culturally varied, so we really need to extend this work to other cultures and language contexts. We've totally ignored all the other kinds of speech content that is present in these interactions. In some ways, this task does not reflect naturalistic joint attention patterns, and there are other metrics that we're going to look at, including like latency and bid duration and things. So I want to thank funding agencies, many students who were actually absolutely critical to get this work done, and the infants and parents who participated. And thank you all for your attention, and to the organizers of this conference. It's been great. So thank you all. Yeah, I'll take questions.
Thank you very much. Yeah. So okay, it's time for a question. Is there, okay, I can see one question there.
I got the babies. With the baby statue, yeah.
Hi, thank you so much. It was a really nice talk.
Thank you.
So, yeah, I had one question about we already talked about how you didn't look at the other content types. But I was wondering, in general, did you look at combinations of the 2 kinds? So, for example, an object label look, dog puppet, for example. And did you take into account those kinds of combinations? Were they frequent? How did that kind of?
We haven't had a chance to do that yet, and I would like to do that, right? There's going to be a kind of limitation because, if you think about it as time series of these different variables, right, you could end up with a kind of data sparsity problem. So we'd have to think of ways to kind of categorize them, kind of classify different sequences, right? So maybe starting with object name early in the bid versus late in the bid. That's been one question that I'd like to get at. Or if, there could be something like, look, so attention eliciting, then the object name, look, the giraffe, look at the giraffe, or something like that, some kind of elaboration like that. So yeah, I mean, all these data are available. So, if anyone wants to do a deeper dive into the content, contact me. But good question, yeah.
Perfect. Thank you so much.
Yeah, it's quite interesting. I I'm curious about the ability to. So one was all the infants all seemed to not be able to pay attention. Like they were all like 0.25 around. They're all pretty bad. So I was curious why you think that's the case. And one thing that pops to mind is maybe there's different kinds of joint attention or things that they care more about paying attention to than just looking at objects. But what are your thoughts around that?
Yeah, well, so for sure, one issue is that in this study, we're looking at the months when when some of them are just starting to show joint attention. Now, on the other hand, we've asked parents to have the goal of trying to get their infant to do it. And it's kind of interesting when you watch. We actually started this at the 4 and 5 month visits, and it's kind of hopeless at 4 and 5 months, you know. So it's kind of a difficult task for the infants, and therefore it's a sort of odd and challenging task for the parents. So that's, I think, one of the largest things. The other thing is that during that period, they would try multiple times to shift the infant's attention to these puppets, which were also out of reach. So it's kind of in some ways not an ideal task for infants at that age to ask them to keep looking at these things that are out of reach and switch from this one to that one. And I mean, if they got frustrated enough, it ended the session. That didn't usually happen, but it just might have not been super motivating to the infants, right? We have to consider that. Yeah,
Thanks.
Good question. Yeah, thank you.
Okay, so let's thank the speaker again.